I am a medical health officer at Fraser Health, and I lead the regional response to the opioid crisis, which has been brewing for some time. The public health emergency was called in April. I could say a lot of things about this tonight. I could probably talk most of the evening, but what I will cover specifically for you today is some of the epidemiology of fentanyl deaths that we've been seeing and opioid deaths, as well as some information for you about how you can identify an opioid overdose, how you could respond to an opioid overdose, including naloxone, and how you could potentially protect yourselves from an opioid overdose. So that's what I hope to cover. Excellent. So as I mentioned, a public health emergency has been called over drug overdoses. This happened in April of this year, and since that time, responses to the crisis have been mounted at the provincial, federal, regional, and local levels, and every effort is being made to try and reduce opioid overdoses and opioid deaths. It is definitely an uphill battle in many ways, as you will see. The overdose deaths in British Columbia have increased dramatically over the last 3 years. In 2014, we started seeing an increase, and in 2015, we knew that something not good at all was going on. And by coming close now to the end of 2016, this is data that's up to the end of October, so 2 months short of the year. We've already surpassed the deaths by last year, and there's projected almost 700 deaths this year. Current numbers are 622, but unfortunately we're at about 2 deaths a day, and the numbers are certainly continuing at a steady rate. And this is happening all across BC, as I'd like to show you next. It's not a problem that's localized to any specific part of BC or any specific health authority. So did this work? So yeah, there you go. So you'll see here, for example, that the 2 health authorities that we're closest to, Fraser Health is where we live, and Vancouver Coastal is right next door. The rates of overdoses in these 2 communities are pretty similar, around 14 or 15%. Fraser has a higher number of overdoses here. There's 211 so far at the time this data was published, and partly due to the fact that we have a bit of a higher population overall, so that leads the rates to be the same. But certainly this is being seen on the island and interior and all across the province. And although it's not my area, overdoses and overdose deaths are increasing in every province, I've been told, and across the country. There was a meeting in Ottawa not many days ago trying to see how federally this crisis can be addressed. But today we're speaking specifically about Fraser Health, and here in Fraser Health alone you can see how the trend has been going upward very significantly in the last couple of years. The projected number of deaths in our region by the end of this year is currently at about 250. And there's no community within Fraser that's immune to the increase. Although there are some communities where the problem appears to be affecting them more, every community is seeing increases in overdoses and deaths over the last number of years. And there's the data isn't necessarily reported exactly how we live, work, and play, so this is the closest that I was able to get to the community that we're in today. Oh, yikes. Holy smokes. That's a little preview there. So the overdose rates by sex, we've certainly been seeing that males are more affected than females, but females are certainly not immune, and this has been pretty steady throughout the years, but certainly there's been a significant increase across the board, which unfortunately is the theme of tonight's epidemiological presentation. You can see here by age group, again, there have been increases in every age group over the last number of years, but it's the 20 to 40-year-olds who are the most affected by this current increase or epidemic. All right. So here's a map of our region that you can see, and again, the point is that overdose deaths are occurring everywhere. There's no specific area that is not at this time affected. Now, what I took out of this particular presentation for today, since I know others will be covering it, I took out some of the people, the pictures of the people who have passed away, and some of my references to the various memorials that are in place, and Overdose Awareness Day, which occurred a few months ago. But regardless, this point I still want to make, that overdose and death from overdose, it can occur in anybody who uses substances. That's probably always been the case, but certainly more recently with this surge that we're seeing, even those who only use occasionally have succumbed, and basically any drugs that are bought on the street can be contaminated, and I want to speak to that a bit more, because as we're learning more about what might be driving some of this, there's many drivers. It's a complex issue. There's a lot of social and other drivers, but certainly the content of the drugs themselves is changing, and that's one of the things that we need to be aware of. So fentanyl is very much being discussed these days. According to the coroner data in overdose deaths occurring in British Columbia, almost 60% have involved fentanyl. What's next? This is true across the board, and in Fraser Health as well. The number of fentanyl deaths have been increasing in our region very, very dramatically over the last year. Basically what we're learning is that it's very difficult to ever know what is in a substance anymore. There are some people who do specifically seek out fentanyl, and they might get a drug that's stronger than what they anticipated. And there's some people who are not using opioids at all, and they might get a drug that's been contaminated. So the fentanyl and its various analogs, I'm using that term relatively broadly because there's a lot of different versions of it out there, are seen very much in the drugs that are being used, and specifically, as you can see here, the drugs that are leading to death. People also do tend to use more than one drug, and we often see polysubstance use and multiple drugs being used, and this can increase risk of overdose and death as well, and we're seeing that commonly here in, again, this is some statistics from overdose-related deaths and the multiple drugs that are there. Whether they're being used intentionally or whether it's a contamination, we don't know from this particular data. Again, the issue, although my information tonight is kind of dry and numerical and medical, it's real people that we're talking about in terms of the numbers. Every number you see is an actual individual who had a life and family and friends and mothers and fathers and sisters and brothers. And this is some work from the Inner City Youth Experience Project, where they had, was done by BC CDC, and they had some youth kind of draw about various quotes related to their experiences with drug use and overdose and naloxone specifically. And I have a few pictures from here just to provide another perspective on what it is that we're talking about when we talk about the overdose crisis or the opioid crisis. I do really want to emphasize that it seems to be a myth that the problem is limited to people who have dependence on drugs or other substances. Certainly, we do see deaths and overdose and emergency room visits and some very close calls and some, unfortunately, some situations that end unfortunately in anyone who uses drugs, whether it's experimental, they're using it for the first time, or whether they're only using on weekends, or whether it's somebody who's more dependent on it. It really is very true that the drugs don't discriminate. Again, as I mentioned, it's important to understand that it's very difficult for anybody to know what it is that they are using, because there is some widespread, broadly stated contamination in the system. Here's another quote from one of the youth. In case you can't read it, it says, "I mean, going into it, you think that you're invincible and that you'll be able to notice when you start slipping into an overdose and that things are going to be okay for you when you're the same as anyone else." And to try to mitigate that as best as possible, if you choose to consume alcohol or drugs, or you know somebody who uses alcohol or drugs, have a plan, or encourage them to have a plan to reduce risk of overconsumption and overdose. So if you are choosing to use, do have a plan. Make a plan to get home safely. Assume something could go wrong. Bring a sober buddy with you that can call for help if needed. Tell someone, leave the door unlocked, ask somebody to check in. Know your tolerance, but don't depend on your tolerance, because you might not know what's going in. And to mitigate that, do testers, go slow. Use less of any drug after a period of time of non-use, or if you're using certain medications. And don't mix drugs. Don't mix drugs and alcohol. And in the event of a possible overdose, call 911. An overdose is a medical emergency. And 911 needs to be there if you or anyone you're with is experiencing an overdose. Some of the signs of an opioid overdose. Now, understanding that there are many types of drugs out there, which I won't go through. Opioid is just one particular type of drug that right now is causing this particular crisis that we're seeing. But an opioid overdose is an individual starts to look a bit sleepy. They can't be woken up, they might not be moving, and it affects your breathing. Basically what the drug does is it binds to some receptors, and it slows down your breathing to the point of stopping your breathing altogether. And that's basically what leads to death. So as a result, you're not moving, you're not breathing, you might be dizzy or discolored or cold if you're not getting enough air, oxygen into you. And if you're having trouble breathing, or maybe choking, kind of gurgling, strange, just snoring sounds. So if you see anybody in this kind of state, whether you know what the problem is, call 911. I mean, obviously, this is a person that could require medical attention. In terms of a first response, first responders are kind of the first on scene. It's like first aid is the person who happens to be there and see that something's gone wrong. What one needs to do is to try and stimulate the person that might be having an overdose or that's not responsive. And if you can't kind of wake them up on the off chance they're having a nap, but should probably be able to tell the difference, call 911. You can open their airway, and you can do not CPR, but just give breaths. Because like I said, the thing that the opioid does to prevent, that leads to death, is it stops your breathing. So you can give breaths through a cloth or a t-shirt or something every 5 seconds, and that in and of itself could save a life in the time it takes for 911 to get there. And if you happen to have naloxone available, you can give the muscular injection of naloxone, which I'll get to, and then you wait 5 or 10 minutes and see if they require another dose. So I'm going to talk about naloxone a bit now specifically. What is naloxone? Naloxone and Narcan are the same thing. One is its proper name, one is its pharmaceutical name, but they're exactly synonymous. It is a life-saving medication. It temporarily reverses the slowed down breathing that happens from too much opioid drug. It doesn't work for non-opioid drugs as it has no effect. So if somebody's passed out because of alcohol, naloxone won't help them, it won't make them up, it won't do anything, although perhaps the injection would, maybe not. However, having said that, it has no other effect on that person. The only effect it has is it binds with opioid receptors. And if you have opioids in your body, it will displace those, so the opioid drug can't have its effect. If you don't have any opioid drug in your body, then it does nothing. You just eventually excrete it. So from that perspective, it's very safe to give naloxone, even if you're not entirely sure. What might be happening? I'm not entirely sure what's happening.
Yep. Yeah.
Okay, there you go. Okay, here we go. So, as I said, it's extremely safe. It doesn't have any effect on a person unless opioids are present. And the way it works is you have your opioid receptor here, you kind of have an opioid swimming around your body, it binds in there, and that's what stops your breathing. But if you have naloxone coming in, I don't have 3 hands unfortunately, that'll sort of knock the drug out and bind to the receptor for a little while. So the drug is still in your body, it's circulating in your system, but it can't bind to that receptor to stop your breathing because the naloxone is there instead. The trouble with that is that the naloxone has a relatively short half-life, so it only binds to this receptor for a little while. And if somebody has taken a lot of drug, when the naloxone kind of finishes its effect, it kind of peters away, that opioid could still be in your blood and it could still bind back, and you could basically slip back into an overdose. So that's only one of the reasons why 911 needs to be called, because there's no way to predict how much drug might be in a person's body, how much naloxone they might need, and whether they might slip. Like, you just don't know what's going to happen. So medical attention is definitely required, but in the short term, if naloxone is on hand, it can make a very big difference. There's some people have been suggesting that having naloxone available can actually make it can kind of lower people's risk tolerance and make them more likely to use, even though they know that it's dangerous, because they assume somebody will be around to revive them with naloxone. There's no evidence that shows that actually happens, that people actually have that reaction on the whole. I suppose there's always an individual out there who might think that way, but on the whole, based on what we know overall in the population, having naloxone available doesn't increase overall use of drugs. People who are going to use will likely continue to use whether there's naloxone available or not, and it doesn't increase people who wouldn't otherwise use to try or what have you. There's no evidence to show that it encourages increased or riskier substance abuse when naloxone is available in the community in the event of an emergency. So a naloxone kit looks something like this. It contains an instruction sheet, 3 doses of naloxone, some syringes, gloves, a breathing mask, and an information form. They're kind of this big, and you've got everything you need in there. Part of our overdose response is to make naloxone as available as possible. Now, in case you haven't already come to this conclusion yourselves, naloxone is it's a bit of a Band-Aid solution. It's very downstream. It's there once something bad has already happened to try and keep it from getting worse. So it's just one of the immediate measures we can take to try and save a life. But it's certainly important, but there's a lot more that needs to be done in terms of the opioid crisis writ large. So in the spirit of that immediate response and trying to sort of save acutely as many people as possible, we're working on making naloxone as available as we can across the province. So it's relatively new since sometime in the summer, I think it was July, that naloxone is now available behind the counter at pharmacies. There's no restrictions on the purchases. Anybody could buy one. You don't necessarily need a prescription. You don't need to be a certain age. You just need to find the pharmacies that sell them. They're not necessarily in every single location of every pharmacy, so do phone ahead, just so you don't waste yourself a trip. But I think London Drugs, for example, has them, I think, in most of their pharmacies. And a kit costs about $50. You may have also heard about the THN program, the Take Home Naloxone program. That's naloxone kits that are available for free through the BC CDC, the BC Centre for Disease Control. Those kits are intended for people who are using opioids, who are at risk, immediate risk of overdose, are on opioid medications, etc. So I just wanted to make the point. Now, this slide is specific to the pharmacies. I don't think I have a THN slide. Not sure why. But the THN program, you can find out if you're eligible for a free THN kit, or where to get these kits on their website, which unfortunately I didn't include that slide, but I know in my heart. It's www.towardtheheart.com. Toward the Heart. So if you go for that, you can find out everything you need to know about the Take Home Naloxone program. Here's another quote. So now we can talk about something a bit more casually, even though it's serious. And this is my one slide that I included today that relates to the stigma of substance use and mental health and overdose, and how damaging that stigma can be for individuals who need help to seek it. People sometimes don't even call 911 when somebody is close to death because of the stigma issues that are related to drug use. So I particularly like this statement because it speaks to that, and it speaks about how important it is to everyone that we can talk about these issues, and that even though it's serious, we don't avoid it. Not unlike the opening remarks today, which I really appreciate. As I'm almost done, and as I started I could talk for a very long time, which I won't do to you. I hoped to give a bit of an overview of the scope of the issue and some of the medical responses that are available. But as I alluded to a number of times, that's there's certainly very much more that's happening and that needs to happen in the face of the overdose crisis. And at Fraser Health, we're working with a multitude of community partners on overdose prevention, recognition, and response. There's ongoing enhancement of surveillance and use of data to try and help understand how we can better target our services and our responses to various populations. There's work being done on encouraging safe prescribing to try and reduce the drug supply that comes from diversion. The other aspects of the illicit drug supply fall under a lot of the RCMP work, which is also ongoing locally and provincially and federally. We're working through various campaigns, social media, and events like this in increasing overdose awareness and education. We're ramping up harm reduction services across the region, including supplies, Naloxone outreach, peer mentorship, and other aspects of harm reduction. We're increasing access to opioid substitution therapy for those who are ready to move on to methadone maintenance treatment or Naloxone or other forms of OST. We're exploring sites for supervised consumption services. We're improving access to Naloxone, as I mentioned, not only through increasing THN sites, but also making Naloxone available to community agencies where overdoses tend to happen at higher rates, and also ensuring that more and more people in the community are trained in recognizing overdose and administering Naloxone. And we continue to enhance substance use services and supports throughout the region as possible. So if you want to know anything more about the overdose response, including specific information on how to access Naloxone in Fraser Health, you can go to our website